Sometimes a psychiatrist will lie to you. And one of the most common lies a psychiatrist will tell you is that you're no longer on drugs. He might have you on three different medications, force medicated, and then other medications used to cope with the forced medication. This is a recording on APO-lorazepam and zopiclone. Uh, these medications are not recommended for long-term use. Uh, both medications are generally recommended for short-term use due to the risk of dependence and other adverse effects. And combining apolorazepam and zopiclone is generally not recommended because both are central nervous system depressants, and their combined use significantly increases the risk of severe side effects, including profound sedation, respiratory depression, coma, and death. So these drugs that I take so I can sleep are recommended only for short-term use. So it's generally recommended for short-term use, typically for 7 to 14 days. I've been on them for 2 years, and usually not for more than 4 consecutive weeks due to the risk of developing tolerance and dependence. So, what do you do when your psychiatrist tries to tell you that you're not on drugs? You're not on drugs anymore when you're on three that he's prescribed. Um, I was a cannabis user, and I was switched over to Abilify, which was a forced injection. And because it was forced and not my consent was not given, I take sleeping medications because I can't sleep with the disturbance of having the police tackle me to the ground and cuff me and take me to the hospital for a month, which was like a prison. Um, these psychiatric hospitals are like snake pits. They're like it's like jail. Psychiatric hospitals are dangerous places where you can't make eye contact with the patients without some of the patients getting violent, um, because they're upset to be there. Um, if I knew that cannabis would have attracted negative attention from the authorities, I never would have done it to begin with. That's what happens when you become, after the age of 35 years old and you don't have wife and kids and you don't have any property or securities or protection, is you become the target of authorities, and they will force drug you, and you will take psychiatric drugs. And to add insult to injury, the psychiatrist will say, "Congratulations, you're no longer on drugs," when really he's got you on three. And he'll add, besides the cigarettes, besides the tobacco, you're still on that drug. I'm on four drugs. I'm on tobacco. I smoke cigarettes. I smoke tobacco. Um, I'm on two sleeping medications, zopiclone and apolorazepam, which are highly addictive. And the withdrawal symptoms, if I don't take these medications, I get no sleep and I get brain zaps all night. Um, So psychiatrists will twist the truth, and they'll they'll say things that are not true. You know, they'll say you're drug free now. We've cured you. You're drug free, but you're really on three drugs plus what you voluntarily take. Um, it's addiction. It's addiction, and it's bondage to the psychiatric system. And so, what do you do when you're an addict? When you're addicted to drugs and you're being force medicated against your consent? I've got no solutions. Litigation and appeals and all the tedious, boring processes of trying to make your argument and trying to argue is not the life I wanted.